Borno State, healthcare is undergoing transformation in a giant step. Our leader has given us the marching orders and is matched it with the necessary financial support to ensure that transformation of healthcare services takes its root. What we're saying is a basic microscope. We have electron microscopes, etc. But this is a basic one which can be used in our healthcare facilities, including primary healthcare institutions. We're grateful to His Excellency for all these innovative ideas and programs in the state. And what we've witnessed this morning is just part of the equation to ensure that one aspect that kills our people, malaria, is fully taken care of.
We don't have enough microscopes in the lab. We used to have it, but some of the microscopes were being damaged by the recent floods that affected our facility. So this will go a very long way in helping the community at large, especially those people that are living around the custom area, Mona area, which are the vulnerable patients, vulnerable people. So we have lab technicians and lab test scientists. So they are very well trained to operate those microscopes.
In every laboratory, if there is no microscope, virtually the laboratory is dead. This microscope is going to take us a long way improving malaria cases in the hospital. There were a lot of challenges before now, because sometimes we have to refer our patients, even if the patient is in critical condition, we have to refer them to tertiary institution because of lack of microscope. But now we are very much happy since we have gotten one.
NHED, Network for Health Equity and Development, decided to distribute 28 microscopes to secondary facilities in Borno State. And the reason behind this direction is because the World Health Organization recommends that for every treatment of malaria, there has to be a confirmation. And the only way we can confirm malaria in this environment is to either do microscopy or use malaria rapid diagnostic kit. But the gold standard is microscopy. And that is why we are strengthening the system by distributing these sets of microscopes to secondary facilities. We expect that this will enhance and improve diagnosis and also reduce the misdiagnosis that is possible to happen in some of these health facilities. And apart from that, the IMPACT NHED in Borno State has also been involved in ensuring that the system is strengthened by the trainings, the supportive supervision, the mentorship that has been provided for all the primary healthcare facilities within the state, most especially the accessible ones. And we are sure that if we continue like this, we'll be able to contribute our quota as an organization to malaria elimination in Borno State. And all this wouldn't have been possible if not because of the immense support that we have received from the Executive Governor of the State, His Excellency Mallam Gana, Umar Azulum, FNSC, MNI, who has provided enabling environment for us to operate. And then the Honorable Commissioner for Health, who has also provided direction, leadership for our implementation, especially within the Ministry of Health. All the other organizations, the agencies, departments, parastatals, the State Primary Healthcare Development Board, BODMA, and very importantly, the State Malaria Elimination Program, who is headed by our newly promoted PAMSEC, Mala Waziri, who has provided direction and guidance for our implementation in the state. And I will not forget to also appreciate my team, the members of NHED in Borno State, for the support, dedication, and hard work. And it is with this that we'll be able to achieve thus far.
We are very grateful for the Malaria Impact for providing this microscope to us. Before we are using our old microscope, this is Olympus, but now the Olympus is having fault, the lens is not clear. You can't even identify some parasites because of the lens. And now we are very grateful for the Malaria Impact for providing the microscope to us. This microscope can make us to identify different parasites of malaria under the microscope. But by using this malaria kit, it only specifies the parasite, that's Fusarium or other disease. But under the microscope, you can identify different parasites under the microscope. The patients are very, very happy because sometimes patients will come to the hospital. If you tell them this is your bill for malaria test, they say, we don't have money. But for now, we are doing malaria tests free for them. Even the drugs, the treatment of the malaria is free. So we are very grateful. We are saying thank you for the Malaria Impact.